If you're anything like me, like learning anatomy through sports injuries, this is episode 69, and this is Luke Shaw, September 15th, 2015, Manchester United versus PSV. All right, so Luke Shaw is going to make a run here, and he gets tackled by a guy named Moreno. All right, and this actually isn't going to be called a foul, but he immediately grabs that right leg, and let's take another look at it here. Of course, we have another angle. So he's going to go for this ball. Moreno's going to dive in. Now, his foot is planted. Luke's foot is planted. And as he plants, he gets tackled by Moreno, fumbles over his own leg, and it snaps in half. Okay, you see that cleat or a boot, as somebody said it was called, is horizontal, and that is not good if you are Luke Shaw. So what happened here? They actually called it a double leg fracture. Now, when I think double leg fracture, I think bilateral fractures, like both of your legs break. But what it turns out to be is a tibia and fibula fracture, okay? It was displaced. I put open because I'm not sure if it broke the skin, but if we take a look at this, the shin guard here, you can see that it's raised where the tibia might be poking kind of out of the skin. It wasn't really reported, but obviously that's displaced, and that's not going to be good if you're Luke Shaw. Your foot and leg is not supposed to be able to do that. This is an x-ray. I'm not sure if this was an official source, but this is what it would look like. You can kind of see you don't need to be a radiologist or a tech or a doctor or anything like that to understand that it's not supposed to look like that, okay? So what happened? It's the tibia is the second longest bone in the body, okay? It is known as a long bone. It's literally what it's called. It is the most commonly fractured long bone in the body. But do you know what the longest bone in your body is? Tell me right now, because it is the femur, all right? That is your thigh bone. But what did they do here for Luke Shaw? Okay, so on the field, they did a stabilization and put him on a stretcher. He was actually down for about 10 minutes. It was a 10-minute stoppage where they secured him and put him on a backboard or a stretcher, and they took him off the field and transported him to the hospital. He had emergency surgery where they did an internal stabilization, which means they basically put rods and screws inside underneath the skin. There was no external hardware here. This is what it would look like. Really gnarly surgery there. So he actually needed a second surgery because he was having blood clots in his lower leg. If they put him on a plane with blood clots, the pressure of the plane would cause the blood clots to leave the lower leg and go into his lungs and possibly kill him. Larger worry was that he could have lost this leg due to deoxygenation and blockage of blood flow from the blood clots. But nonetheless, he didn't lose his leg. He did return 11 months later from this injury, a little bit of a longer extended recovery. It should have been about 6 to 8 months, but he took 11 months to recover. But he is still playing today for Man United. So that is Luke Shaw.